the more your clitoris is sucked or stimulated is not going to enlarge it, that it will just be loose and hanging.
Okay.
I mean, we say that about like breast and nipples being sucked. Like the more a woman's breast is sucked, the more
that's why her breast is hanging.
It's called muscle tone, not necessarily it being sucked. Because if our sexual organs can enlarge by being sucked, I'm pretty sure a lot of our male counterparts would like their penis to be sucked.
Let's be honest.
Because, and I'm pretty sure they know that the more sucking doesn't cause them to get larger penises.
So then the more sucking of this does not make it hang.
So do more sucking and suction. Close your mouth like a vacuum so we can really feel it.
Welcome back to part 2. If you've not watched part 1, what are you doing? Go back. I need you to go reverse. Go back and watch part 1 because listen, it was juicy. I'm about to go home and wait, my man is not here. Anyways, we will talk about other things. But yes, welcome back to part 2. You are watching Relate with VanJudah with your one and only Nzima Queen. Listen, let's get to it because I just want us to go back to it, okay? So go back and watch part 1. In part 1, I said I was giving one of this penis ring. I'll give 2 out, but I'll put the details in the caption. So just watch out for it, okay? But go back and watch part 1. Part 2, let's go.
We're going.
So I have a question, okay?
Yes.
The clip, okay? Let's do this one quick and then get to other ones. But the clip, okay? Rumor has it that the more it's sucked on, it's being pulled, right? So then it leaves your, let's say the clip hanging over there. Is it true?
Like having a penis and a vagina.
Yeah, so it's like, it's just hanging.
No. So during intercourse, I talk about a lot of blood flow, enlarging your labia and your clitoris. But the more your clitoris is sucked or stimulated is not going to enlarge it, that it will just be loose and hanging.
Okay.
I mean, we say that about like breast and nipples being sucked. Like the more a woman's breast is sucked, the more
that's why her breast is hanging.
It's called muscle tone, not necessarily it being sucked. Because if our sexual organs can enlarge by being sucked, I'm pretty sure a lot of our male counterparts would like their penis to be sucked.
Let's be honest.
Because, and I'm pretty sure they know that the more sucking doesn't cause them to get larger penises.
So then the more sucking of this does not make it hang.
So do more sucking and suction. Close your mouth like a vacuum so we can really feel it.
Ooh, I like that. She's like, close your mouth. Let it go. Take notes, guys. Take notes because it's about to go down. So while we are sucking and suctioning and sucking and suctioning, let's oral sex.
Oh, yeah.
I have heard this ABCDEF about oral sex, okay? Does oral sex, is it bad or is it a good thing? I know you say it's a great thing.
I mean, yeah, I would say it can be a personal preference. I think if you have, some people are raised in the culture, like in America, oral sex is a huge part of our culture.
Yeah, but other cultures,
is like, that's absolutely taboo. That's disgusting. Mouth and genitals don't go together.
Okay.
But it's not a bad thing if you're partnered in a monogamous relationship, or even if you are in a polygamous relationship, you have that trust and safety factor that you're not going to exchange sexually transmitted infections. Disease. With any part of sex, you want to know your status.
Okay, yes.
Period. Go get tested.
Get tested.
If you are under the age of 25, you should get tested every 6 months.
6?
Yeah.
What if you're having sex with the same person? Well, what if they cheat?
It's not even that. Actually,
she meant that.
It's not even. It's possible, but even like in a marriage, you know, like you're pregnant, we do the whole STI panel, and something comes back positive, and it's like maybe it was there, maybe it wasn't, and maybe somebody brought it in. But it's important to know your status every 6 months under the age of 25 because. When you talk about oral sex and people talking about, I know on TikTok there's this huge thing.
That's the reason why I want to ask, because there's a huge thing on TikTok about it. But go ahead.
Yeah. Well, tell me what you heard on TikTok.
Because I heard oral sex causes cancer.
And you think it does or it doesn't?
I don't think so.
Did it scare you?
It did, but I don't mind. Look, I like my man going down.
You're willing to expose yourself to cancer.
You can enjoy that cancer.
Oh my God.
Hey, no pain, no gain.
Yes. Any part of sex
I
can put you at risk of developing a sexually transmitted infection.
Of course.
So what should have been explained on TikTok is oral sex itself isn't going to cause you to get cancer, but it can increase your risk of developing something called the human papilloma virus.
HPV?
HPV.
Oh, that's what it is.
That's what it is. So HPV,
I've seen the commercial, but I've never
there's no
understood
testing for HPV for our male partners, but HPV is tested when you get a pap smear. Mm-hmm. And it's usually co-tested. Like we test both the pap smear and the HPV after the age of 30. Before that, if you have abnormal cells around your cervix, we will test you for HPV. But the reason why we don't do like routine tests is 80% of Americans have HPV.
Really? Wait, but how would you know you have HPV?
You wouldn't know.
You wouldn't
know. And even if I test positive, I wouldn't know who I got it from. So
wait, how? What if I'm having sex with one person?
Exactly. But that person could have had sex with someone else. HPV is sexually transmitted. So even if you're a virgin at marriage, if your partner is not a virgin, you're both at risk of contracting HPV. Now, when we talk about oral sex and cancer, it's the HPV factor. Okay. So a male counterpart or female counterpart going down on another owner of a vulva or
because
vagina.
Most of the time they don't say when women given head, but they say when men haven't given oral, they end up sick.
When we talk about these counterparts that our partners that like to eat out the vagina.
Eat it out.
If I'm HPV, if I'm HPV positive, you're going to clean out some of that HPV too, and that's going to kind of go in the back of your throat, increasing your risk for cancer, throat cancer, oral cancer.
You know, right now I can see all the men like, oh, we're not doing it anymore.
Well. Let's start with this, but you can also increase my risk of developing cervical cancer.
How?
From penetrative intercourse. So you putting your penis in my vagina, because you probably could be the carrier of the HPV. It's not necessarily in my vagina. Who put it there?
So at this point, we're all at risk, no matter what you do.
At risk, and that's why it's important to be in trusted monogamous or trusted polygamous relationships where you know your status. If you're under the age of 21, you're not eligible to get a pap smear. Usually our HPV infections clear up on your own. So even if you are positive for it, your body will clear it on its own, typically. Now, 21 and over, please go get a pap smear if you are sexually active. If you are still a virgin, you don't necessarily need to get a pap smear.
automatically check for HPV the moment.
We check for abnormal cells. And if we see some, then we're going to check for HPV because that could be the cause.
Can a man get tested to make sure he doesn't have?
I'm sorry.
Wait, hold on.
I know. It's a one-way street.
That's discrimination
on
behalf of all the women.
I know.
He can get tested to make
sure.
For
HPV, but you can get tested for chlamydia, gonorrhea, trichomonas.
Yeah, but
herpes, all the other stuff. Yeah.
But HPV leads to the cervical cancer. So why can't they test and make sure?
It's not.
Well, you can't just go and test for cervical cancer. It might not show at the moment.
But he doesn't have a cervix to have cervical cancer.
Oh, sure, yeah. I just thought about that.
Just like we don't test men for bacteria vaginosis.
Hold on, don't do this to me. My brain went off like real quick. Like I was like, wait, after I said it, I was like, wait a minute.
Yeah.
There's no cervix for him to get. Okay, sorry guys, sorry. Let's get back to it. Don't mess with me up.
Oh, good.
My brain, I'm stupid.
I know, it's confusing.
I'm so stupid.
But it is a popular virus, and whatever country you're in, you should always make sure, especially if you're over the age of 30, you should have a pap smear with HPV testing. Women have it. Just like get your pap smear starting at age 21 if you are sexually active. If you're still a virgin, obviously.
So how can a man test after giving oral sex to ABC?
They need to go get an STI panel. Get tested for syphilis, chlamydia, gonorrhea, trichomonas.
It's not only women.
HIV.
But right now they have the home testing, so you can just order it online and let it come through. Right.
And I don't know how reliable those are.
Okay.
How reliable do you think someone is to do the sample correctly? So it's best
find you a doctor
to get yourself a provider. Find yourself a clinic. They have a lot of free clinics. and get tested. Know your status before you enter the relationship.
She said that. Please ignore when I said that. Cervical. Okay? Please ignore it. Don't come
So,
for me.
oral
Don't
sex
come
is
for
indeed
me.
a great thing to explore,
Okay.
both receiving and giving, as long as you're with a trusted partner.
Trusted person. Get tested as often as possible, people.
Yeah.
Get it.
For sure.
But since we're talking about men, I want to attack the men real quick since I played myself.
Let's get on it.
I have been seen on Instagram. I want to talk about things that we have been seeing on social media.
Okay.
That's what we're about to hit right now.
Yeah.
Instagram. I have seen most, especially the Nigerian people, Nigerian influencers lately.
Yeah.
They've been promoting this drug that makes your penis bigger.
Oh,
I have seen them. It's like a herbal mixture. Even I've seen Ghanaians.
Oh yeah.
Ghanaians do that. They'll go to Ghana and when they're coming back, they'll come back with so many
herbs.
Talking about it makes your penis longer. It will make you last longer.
Yeah.
How true are these? Like, is there something that, because I want to talk about the women too, because there's one for women, but the men, how true is it? Can something make your penis bigger?
Prayers. No.
Jesus can't save you now, son.
You know, these are, we as Africans love our herbal influences. I mean, we do. I mean, you hear that chewing tiger nuts is going to give you the aphrodisiac. You have orgasm.
I heard tiger nuts and coconut.
Yeah, we know. We all have had tiger nuts, and some of us haven't had an orgasm. So we'll leave that there. I think penis enlargement is confusing because there's a lot of people who are going to sell items and drugs and drinks and concoctions, and it's a mental thing. You're born with the size of your penis, and as much as our male counterparts think that their penis is small, okay, man, listen. Your penis is probably the average size or even above average. The average penis not erect is 3 inches. And erect is like 5 to 6 inches. So you're good. If you go and
the purchase she's given
some of it, I know, but you gotta imagine it. So next time, if you want to go to your male partner, no, I'm just joking. Don't go measure them.
Don't go.
They
measure.
have measured them themselves,
I would do.
and that's something we've seen on social media of them like sticking tapes and strings inside. Please stop doing that. You don't need to measure the length of your penis that way. Stop that. But those concoctions are really not going to help. Now they might do some other things to your body. They might mentally make you think that your penis has grown in girth or longer, but a lot of times these surgeries are temporary.
Yeah, because I was going to ask, can you do surgery to enlarge your penis?
There are a lot of different surgeries that can change the size of your penis or the girth, but that's a risk that some might be willing to take, knowing that if someone is going to perform surgery on your penis, will it work when it's done? There's some risk and benefits.
What if it doesn't work after it's done?
What if it can't erect?
Then you're stuck with that. I'd rather stick with my short penis.
There are some approved pills and medications like Viagra and some of the other ones.
But that makes you just perform. Viagra is more for performance.
Yes.
Right?
That make you hard. But no, size, no.
You're stuck with your baby penis. Sorry.
But they're not.
It's a baby.
And you know what? It's not even about the size.
Well, listen to her. She's trying to be nice to you.
You know what? Even
it's
if
not
you had
the size.
It's not the size. The performance. Because let me tell you about the 10-inch penises that don't have enough blood flow to keep it erect and doesn't, because if you have 10 inches of a penis, but my vaginal canal is only 5 inches, or my vaginal canal is like 7 inches.
You can only do 7 inches, baby.
I'm not really even getting that stimulation on my clitoris from your pelvic bone because you are hardly entering.
But then they be bragging. They be bragging.
So anyways, I just think it depends. I mean, you can go deeper in some positions. You know that.
But since we're told we can't take medications to make your penis bigger, what about vaginal tightening? Because I have heard everything in the book from yogurt to Kegels, because I'm going to ask about this. Yeah. To alum spice. Yeah. Alum, however you say it. Because recently that was one that popped up. Yeah. I think the most recent that popped up on Instagram. Pretty popular. Is the lady with the weird, her voice was still cringy. It's making my ear like itch. Sorry. But her voice, she was talking about putting alum in your vagina to make it tighter. Yeah. Right? I've heard everything in the book. Putting Kegels in your vagina, it will make your vagina tighter. Putting God knows what. Yeah. Can you make your is there a such thing called loose vagina and tight vagina? Just please, let's talk about that.
So, what is a vagina first? The vagina is a muscular canal in your body.
I'll hold it for you.
Yes.
Please teach these
In
people.
there. This is a muscular canal. This vagina, like we should open it up. It's got Rugai. It's got, lubrication, natural lubrication. Our vagina is amazing.
Right there.
I want to clear up the fact that I can have sex 100 times and that does not mean my vagina is going to be loose. In fact, I can give birth to 5 babies and my vagina still be nice.
But what is a loose vagina, though?
It's not necessarily the vagina. It's prolapsed pelvic floor. It's the pelvic floor is prolapsed. Like things, that could be your abdomen, your bladder. That could be a lot of different things in your pelvic floor, your organs. So when people say, oh, the vagina is loose because the penis goes in and doesn't feel the vagina hugging, it might be your girth.
You ain't that big. She just saying
I'm
you
just
ain't
saying,
that big.
Penis sizes are not just the length, but it's the girth. Some are skinnier than others.
Of course, yeah, that's true.
So you can't really put it on me that my vagina is not tight.
It's you.
Yeah.
But can you put a lump in your... I want to really...
You
Because that
should
video
not.
was cringy for me.
Ugh.
Because I read it because a lump, I know it makes it dry.
It makes it dry. That's the whole reason why they're getting... For someone, I read that you want instant vaginal rejuvenation, put some alum spice, other known as potassium, in your vagina, and it will instantly tighten. Yes, it's going to instantly dry it up. If that's what you want, that lack of estrogen,
Doesn't it have side effects?
Oh, of course it does. It could thin the walls of your vagina out. It could cause damage. It could prolapse some other organs like your bladder. It could, and if it takes away all my lubrication, then it makes me seem like I have a vagina that has not enough estrogen like we experience in menopause. Why would I want that?
Okay.
I'm uninterested.
Please,
So,
do not.
don't do that.
Is there anything you can put in your vagina to make it tighter?
I mean, these Vanway balls,
Yes.
you can take a Vanway ball and you can insert it into your vagina. And you can, it's the strength, the muscular tone, like how this may not stay for everybody. Like, so if you've given birth, it takes some time for your pelvic floor to strengthen. It's all about strength. And remember, your vagina is a muscle. If you want abs, you work on your abs. If you want to strengthen your pelvic floor, you strengthen it with exercises.
I have heard myths about Kegels, strengthening your pelvic floor. Does it make you orgasm faster or orgasm better when it's stronger, when your pelvic floor is stronger?
Absolutely. I think that all has to do with the orgasm and sexual experience. Is when you have a strong pelvic floor. You have more sensation, more control.
Okay, but what if somebody puts a lump and it makes them tighter? Because
It's going to make you drier.
Because I'm telling you, there's a girl out there somewhere who has shoved that in her.
Oh, there's also a girl who shoved some garlic or some
I've heard
menthol
garlic,
or
yogurt.
ginger. A lot of Africans put ginger in there to tighten things up. It's just going to burn
in your vagina.
Oh yeah, to tighten it up. It's just going to burn and
Ooh,
dry it out.
I felt an itch real quick.
I don't put anything in my vagina like that. So,
but then when
no
people with
fruits or
yeast
vegetables.
infection, they say put yogurt or garlic in there. It makes it.
Okay, you're not supposed to put any kind of yogurt or garlic.
But
for
you've
yeast
heard it,
infection.
right? Have you heard it before?
I've heard of these
I've
things.
heard
People put
yogurt
fruits and
and
vegetables. People put
apple
foods.
cider vinegar.
You shouldn't put any of that. You should not. You're just destroying your natural pH balance. Your vagina is supposed to be acidic. Don't be. Stop putting things in your vagina. Can you leave your fruits and vegetables in your fridge and your yogurt? I mean, it's like when you're like in the middle of sex, you're like, babe, go get the whipped cream. Yeah, don't put that in my vagina though. You can put it on like my nipples.
Back, no pause.
I mean, you can't put whipped cream in my vagina.
I have heard people, I've had somebody, right, try to get me to try with my man. And I'm like, I'm not putting honey in my vagina.
Honey.
But they're like, honey, gummy
I've had
bears.
people say
Strawberries,
yes.
Gummy bears, strawberry.
Yeah,
I've
we're
heard
not
grape.
doing all that.
I've heard pineapple.
Ooh.
Okay, since we're talking about putting things in your vagina.
That sounds terrible.
This is just by the way. Does anything, can you eat something that'll make your vagina taste
sweet.
The way it is? Like I've heard pineapple, I've heard watermelon.
Yeah.
Recently I caught myself eating everything.
And what did he say? Did he say it tastes like watermelon?
It tastes the same.
Yeah.
But putting watermelon, eating watermelon, pineapple. I can't eat pineapple. I'm allergic to that. So I
don't do that.
Watermelon. I almost did it.
Oh my gosh, just so it would taste.
I was like, I would just drink the pineapple juice and then I'll just use my EpiPen later.
Oh,
I've tried
not
it.
for the sake of the
But
sex.
so many people
No,
have said it.
I mean, if you want to include some flavors, they have flavored condoms. We have flavored lube. We have chocolate lube. We got banana lube. Yeah. We got chocolate lube. We got strawberry lube. If you want to explore flavors, get things that are safe and appropriate for the vagina.
So you're saying you can't put anything in your vagina?
You just can't put anything in your vagina. You're only born with, well, some of us might have two, but that's a different topic. But you're only born with one vagina.
What about a clit? Like they put a little whipped cream and strawberry.
That just sounds irritable. That sounds like I'm going to itch later. And then if it happens to seep into my urethra where I pee from, sounds like a whole UTI. Sounds like some burning urine. So I think like if you want to like really explore, they have flavored lube. I mean, this is just regular lube, but they have flavors.
Okay.
But I've had people tell me when I say, oh, use jelly, like lubricant jelly, and they go and buy like Smucker's purple jelly.
You're lying.
No.
They really buy
They
grape.
do that.
But then it makes it cuter.
But
like
it's, no, that's not cute. I'm not saying that is you don't know and you're naive and that's okay. Because
but you're saying jelly. That sounds like people putting whipped cream on your vagina.
Yeah, we're gonna leave the whip. You can put the whipped cream on the nipples and lick it off real quick, but don't put it inside my vagina. Yeah,
I have not tried it.
We're not gonna do that.
I have thought about trying it. I've been thinking, but honey is sticky, so I don't want to do honey. But I've been advised to try honey, gummy bears, all
gummy bears. What if the gummy bear gets stuck in there and it starts to?
I've been told to do like what they'll say is drizzle honey. What is it called? Honey, and then just throw the gummy bears on top
and let them eat the gummies.
Yes, Jocelyn Hernandez.
If you need a bowl of honey gummies, you can eat it when we're done. But what's not gonna happen is, and you get an orgasm for that?
Some people, I have not tried it. I've not tried anything in my vagina before.
I think like something that's safe and that's really pleasurable when you're giving oral sex is put some ice cubes in your mouth. Oh. That cold, wet sensation when you're licking the clit, sucking the clit or the penis. Oh, yeah.
But nothing will make your vagina taste different or taste better.
No, it is what it is. You know what's going to make it taste and smell nasty is all that stuff you just talked about putting it in. Okay. Sounds like yeast and BV all at once.
So all the people drinking cranberry juice and pineapple juice mixed together to make it taste good, it doesn't taste any different.
I don't know. I don't think so. But for the male viewers, maybe put it
Somebody
in the comments.
Please tell me in the comment. Does drinking a
if
pineapple
you think
juice
it, yeah, if you,
we ain't tried it over here.
It's an absolute no over
for
here.
Me. Lubricant.
Oh, yes. I love me some lubricant.
What? Okay, lubricants are meant for, let's just to add a little stimulation, right? If you get dry. What?
Yeah, like to lubricate. There's so much taboo on lubricants. Like, why should I use lubricant? Like, I mean, if I'm losing lubricant, it means I'm not getting her wet enough or he's not wet enough. But
I've heard that.
Our hormones determine how wet or how much vaginal discharge or fluid we're releasing during our sexual intercourse. Mm-hmm. So using lubricant isn't a bad thing.
They'll rather use spit.
Okay, how about no? I don't want your spit.
I intentionally, brother. No, rather
I know. I've seen them. They'll be like, oh, you're not wet enough. Let me spit on my penis and then put it in.
Or like their hand.
Oh, stop. You know? Like even when men are trying to get themselves erect, they're like, let me just, or Vaseline. Ew. People masturbating with Vaseline.
That's disgusting. Okay.
Shea butter. Or we could just do some lubricant. They both of them you got to purchase, and this is safe. Silicone lubricant is my favorite. A little bit of silicone lubricant goes a long way. The other thing with lubricant is you want to make sure it's safe.
What are the difference? Because I've seen water-based lubricant. I've seen jelly.
No, water-based oil and silicone.
What about the gel?
Which gel?
Gel lubricants.
Like that. You like the flavors?
No.
Yeah, but they're either water-based oil. There's only 3 categories. Water, oil, and silicone. So they could be gel.
Okay.
But they have to be water-based, which is safe for condom use. Oil-based is not safe for condom use. So if I'm in a relationship and I'm partnered and I'm trusting them and we're having unprotected sex, I could use oil.
Okay.
But silicone, no oil and condoms. They don't go together. That will break. The oil breaks down the condom.
Okay.
But water doesn't, and neither does silicone. Silicone and water are safe for condom use.
Okay.
Now, coconut oil is something that we have in our house, you know, especially if y'all like to whip up that shea butter. Mm-hmm. Yeah, I bought a big one from the store. It's like $10.
The smell.
You don't like smell coconut oil?
I don't know why. I don't like the smell.
Then I wouldn't do that. But if you want to
I would
try it out.
I don't mind trying.
But
so
that
give
one,
it.
you
Bring
can't,
it. Hold on.
because it's oil, you cannot use it with a condom. So this is
I don't use a condom.
She's also partnered in a trustworthy.
In a trusted, very trusted relationship.
Trusted, yes. I know. It feels different when you have sex without a condom. I know it feels good.
It feels good.
Yeah, it feels good, yeah. But if you are not ready, it's not even just about being in a trusting relationship. I also have to be willing to, if I get pregnant, I'm okay with it.
Think about that, yeah.
If you're not, because I feel like sex before marriage is anxiety provoking, because I don't know about you, but I'm waiting for my period after it. I want to know, did you pull out? Was it pre-cum? Should I get the plan B done? It's now, is my period coming? Now my period is late because I'm overthinking. Let me go online. Let me go on Google. Let me get back on my Flow app and see what's going on. It's anxiety provoking. So you want to make sure if you're going to have sex and you're not ready to have a baby, you're using protection or you're on some sort of birth control.
Yeah.
Because honestly, the anxiety around that, I can't even have an orgasm when I'm thinking, oh my God, are you going to come in? Are you going to pull out? Is your pull out game 100%?
You know when you finish it, you're like, did you pull out? Did you?
Let me see the condom. Let me inspect it. Yes. Tie it with a knot. Yes. It's anxiety provoking. How was I supposed to orgasm through that when that's what I was thinking about?
What if, let's not stick with one person. I stick with a trusted relationship.
I agree. Get yourself one partner, or if you're in a polygamous relationship, it's your own choice.
Each your own. To each his own.
That's fine.
Yeah. Back to what we're saying.
Can I talk to you about condoms?
Yeah,
I don't know you like condoms.
I hate condoms.
But
it doesn't feel the same.
Why?
I don't know. Like without the condom, right? It feels
really
good.
It feels more intimate.
Because you know how they have bare skin like. Yeah. They have different types.
Yeah.
Without a condom.
But there's a lot going on with all these STI infections. Yeah. You know where we live is like high rates for syphilis right now.
Really?
Yeah, it's a huge outbreak. Get yourself tested if you live near us.
Damn, we're in Ohio, so my Ohio people,
Franklin County specifically.
Go check.
So like, one of the other things I get is people be like, "Oh, I can't fit a condom." Like, look at that condom and look at my penis.
Your penis is not.
I'm like, baby, you can fit a condom.
You can.
No, I can't.
Stretches.
It stretches. Can I show you how much it stretches?
Yes, please show me.
Ball your fist. And hopefully my nails don't break this, y'all, because that would be terrible. Woo! So if your penis is bigger than her arm,
your penis is not.
Look at the girth on that arm and hand, honey. She moving her hands. Y'all not ready for it.
But then when you go to the store to buy condoms, there's different sizes.
There are, and we all like to get the Magnum extra large.
You know you're not Magnum extra large. You know. You and I both know.
It's okay, baby. If you want to get that on and
to feel better about
yourself. Just to feel better about yourself. But if it slips off, you're going back to the regular size. Because the worst thing, have you ever had sex and the condom gets stuck in you because it came off?
And you gotta pull it out? It has never happened.
I'm sorry. Can you please go down
what's
the
the point of the condom?
There's a size condom for everybody to use.
I'm crying tears.
I know. But let me tell you about my lubricant. See, now that I got her hands already lubricated from that condom. Have you ever used silicone lubricant?
No, I haven't. I use water-based.
Honey. Let me introduce you to something.
What's the difference? Let me see the difference.
Feel this. Just a little bit. Honey.
That's good.
Just a little bit on that penis. Oh, yeah. It's going down tonight.
My man is in Jersey, baby. Baby. Listen, you have 8 hours
and it's not about I'm dry. Whether you have drier
so skin-like though.
Correct. And that was just a little bit. I only gave you 2 drops.
Oh wow, babe. 8 hours.
I'm telling you. Because the thing with water-based lubricant, what I hear is I have to keep adding more during the sexual experience. Silicone lasts longer. No. Silicone lasts a lot longer. Trust me. Get yourself some silicone lubricant tonight, or hit me up in my DMs on OB and Beyond, and I can certainly talk to you about some
forgot
samples.
I was on the show. I forgot I was recording.
I know.
Real quick. But no, that's really, wow.
Yeah, it's good. So you can, put a little bit at the entrance of the vagina,
Wait, it can go in, right? You're fine.
Safe,
It's
safe,
right?
and
safe.
it's safe with wearing a condom. Silicone. It's not going to break the condom down.
So silicone, okay.
Silicone and
oil.
water.
Let's just stay away from the oil, just in case we use a condom.
Yes.
Let's stay away from the oil-based one.
Make sure you guys are using condoms. And if you need free condoms, hit me up in my DMs. We can assist you with that.
Free condoms?
Yeah, they have programs here where we live.
No, but when I go to my my gynecologist office, there's like a bowl sitting there.
I have a bowl. I've got everything.
Oh, wow.
But it's also if you're comfortable. A lot of us aren't comfortable talking to our OBGYNs about sex. And some of the OBGYNs aren't even comfortable saying, how's your sex life? Because it's normally like, when's your last period? How do you feel? Any pain? How long does it last? I mean, one of the questions I said is that, how's your sex life? Do you have pain with sex? And then people are looking like, you wanna go there? And I'm like, yeah, I want to know. With deep penetration, do you feel pain?
Well, so since you asked that,
okay,
I want to ask a question. Not for me, I promise. Not for me.
Okay.
Can you get a tear? Okay, what if after sex you get tested often? You're healthy. Because I have that one of my girlfriend, we keep talking about it. She's trying to figure out why she keeps getting tear. Like every time she has sex, there's a tear.
Oh, she's getting like little small like tears?
Because she checks, she's fine. She gets checked. She's one of the people that like religious. Every 6 months, she gets tested to make sure she's good.
Sure.
Right? And she's in one relationship, but she makes sure just in case anything happens.
Sure.
Basically, after sex, every time, the moment she pees, it feels like a little cut.
Oh, near her urethra?
She doesn't know where, probably. She
So
has tried like pillow to lift her up just so she won't get
lift
a
her
tear.
pelvic floor.
She thought there's other things. Can you get a tear?
Oh, absolutely. You can get small little vaginal tears.
Is that safe?
Oh, it's not about it being safe. Some people are at higher risk of getting that. Some people also bleed during sex because they have really friable, sensitive cervixes.
Okay.
So it's not necessarily not safe. It's unfortunate that that's happening to her. So if it continues to happen and she's really experiencing a lot of pain and discomfort, she needs to see her OB/GYN.
What if they do nothing? Because every time she sees them, they don't really say anything.
Because maybe we aren't seeing the actual tear because it's so tiny.
It's like she doesn't even notice it. She knows because she pees. The moment she pees, she feels the
burning,
like a cut burn. Like when you get a cut and you pee.
It depends where she feels it. Like, is it as she is like streaming her urine?
I'll probably ask her.
Oh, that is probably. So a lot of times we always say like after sexual intercourse, make sure you try to urinate to expel that bacteria. Because remember, if my clitoris and my urethra are literally like next door to each other, as we're thrusting and we're having sex and licking, there's a lot of bacteria also entering my urethra. So try to pee and rinse. So maybe she's experiencing that burning out from the bacteria flushing out. Oh, maybe it's not an actual laceration. Like it's like a
cut every time she has sex. She used to think maybe the man was too big. And then I have a question. What is it, because maybe her vagina is smaller and the penis is bigger?
It's possible. It's possible that, we're not like partnered from. Yeah, but if someone's girth, if I have my vagina and I know, okay, I'm wet, this vagina is wet. So probably this penis could fit inside this vagina, right? Easily. Right there. That happened. Right there. Okay. Now, this girth isn't that big. Now I have a penis that has a really large girth and is also trying to get in, and maybe we'll flip it this way. This isn't going to like...
a long time.
This could cause some minor tearing to my vagina because of the girth, the size. Now, not everybody has this problem with this girth, but
not everybody.
It's possible that she's experiencing that. I would encourage her to use lots of lubrication and try different positions. You know how like when you're like the favorite position... Doggy style.
It's easy.
It's deep penetration, though. It's deep. You feel it in your abdomen. You feel it. It hits.
Yes.
But then when you're like missionary on your back, you don't feel that as much. So she may want to try different positions. Okay. She may want to see, is it better like having sex while I am like straddling the penis like a cowgirl, or riding? It's easy. Okay. Like, because you have control. Or is it better on my side where we're spooning and one leg is lifted up? Okay. Or are you sitting on the kitchen counter?
I'm going to remember I am recording right now. Because
right now, what happens when you talk about sex?
I'm 2 seconds from calling my man like, hey,
oh my God.
Can you get a ticket? Long distance relationship is not it. It is the worst.
It's not true. It can be it because you really value sex. Yes. When you guys see each other, there is no time wasting.
Don't call me.
There's no time wasted.
When my man is in town, please don't call my phone. I'm not going anywhere
at all.
Because I see this man once a month, so
at all. Even when you're on your period too.
Yeah, I don't know. I find it weird.
What about that 5th day when you're not bleeding?
Okay, yeah, I don't bleed on the 5th day. That one, yes, I'm cool. But like, why are you bleeding?
No,
is it
day
safe?
1 and 2. Oh yeah, of course it's safe to have sex on your
I
period.
have heard it helps with cramps.
It
if
does.
you have sex on your period.
Yeah, because you're stimulating, you're releasing, the prostaglandins that are releasing that are causing the cramping in your uterus. Sex.
So it's not weird to have sex on your period.
No, it's gonna help assist with that.
Can I tell you an advice I heard years ago about having sex on your period?
What?
Somebody. God, Jesus. I need to get off the internet.
Is this gonna be related to the Bible?
I know. I need to get off the internet. They said if you have sex on your period, it pushes the blood back into your stomach.
Oh wow! Like then you start having like blocked up old blood.
Yeah, they said if you have sex during your period, it will push the blood back in. So don't do it. I don't know where the person got this from.
So it's usually like a one-way street with the blood flow. It doesn't flow back in. And remember, your cervix is dilating, like barely opening. Like, when people say like, oh, I entered her uterus, you did nothing like that. I mean, this is my cervix. Your penis might hit the cervix, but you were not entering the uterus. Not in my uterus. You were not. It might have felt like that, but you were right in my vaginal
You can't reach that far.
So yeah, sex is safe on your period if you're willing to do that with you and your partner. It's something you want to communicate. If you're bleeding heavily on day 1 and 2, you may avoid it. But day 4, 5, some people have lighter cycles.
Yeah, that's
and
too, yeah.
Especially if you're trying to get pregnant and you want to start having sex, every other day to ensure you captured the egg. Yeah.
Well, wait, hold on. You just said you can't just girl, you can't just brush. Hold on, if you're trying to have a baby, what did you say?
Well, a lot of people don't know when they ovulate.
Yeah, I don't know either.
You gotta pay attention to your body.
Recently is when I found out this.
I remember being in nursing school with one of my best friends,
my phone
and
tracks
she
it.
said, "Yes, your phone can track it.
Yeah, that's fine.
But you should know with your body because your phone is not your body."
I have a sharp pain.
Yes,
somebody told me that's
middle
what
shirts
it is.
pain is when the egg releases. Like my best friend was sitting in nursing school. She was like, "Girl, oh my God, every month I get so wet," and I'm like, "Yeah," and you feel like you want to have sex. She's like, "Yes," and I'm like, "You're ovulating," and she was like, "What?" And I'm like, "Yeah, when it's all wet and gushy." That extra fluid, that slimy, that slimy fluid, it's to trap that sperm.
I think it took me years. I'm almost 30.
No, but I mean, when they talk about getting a period as an adolescent, did anyone say like, hey, it's a cycle and on day 14?
They just told me on when the blood comes, I'm on my period.
And get a pad and,
That's all I was taught.
This is why we got to do better. We got to teach our younger adolescents about this cycle for the rest of your body. You need to know what is going on in your body. So when they say like don't talk about sex, I'm sorry, my body wants me to have sex every month.
So can you explain
from day
why?
10 to 14? So that's how the body is made.
But since we're talking about sex, okay. Well, you know how when people sex during pregnancy.
Oh yeah.
How safe is it? Is it safe? Because I know women that don't want to do when they're pregnant because they feel like. I know men. Let me go back. Men, because I've heard women get horny during pregnancy.
Oh my God, yes.
I experienced it when I was pregnant. It was like I was always like, wait, what is happening?
That hormone.
I'm pregnant.
That progesterone increases.
But then there are also women that don't want to be touched when they're pregnant, right? But then there's some men that say they don't want to hurt the baby. Is it safe?
The good news is the baby is kind of like surrounded by amniotic fluid and an amniotic sac and then the uterus. So that's the awesome thing is man, you are not entering our uterus during pregnancy or any other time for that matter. You may be touching the cervix and you might notice some extra bleeding just because there's so much blood volume in a pregnant woman. So if that kind of turns you off, change your position because that's going to happen with deep penetration when you're hitting the cervix.
Okay.
On average, safe in pregnancy unless you have specific conditions related to your placenta or your water has broken early, you're on bed rest, or you have vaginal bleeding. Then you're going to want to avoid sex.
Okay. So your doctor tells you.
Yes. But entirely on most cases, sex is completely normal and encouraged. Because when you have sex, I don't know about you, but I feel like a sensation of like calming and release and peace.
Has been released.
Like release. I don't even realize that I forgot to pay those bills or I didn't even study. I'm just done.
I want to sleep.
I feel good. Exactly. It puts me to sleep. It's that oxytocin release. It just releases and I'm like, it's time to go to bed.
Let's go to bed.
So it's good to have sex in pregnancy. I think if you have specific concerns or you're experiencing like bleeding, change position. Deep penetration in pregnancy might not be the best option, But I really enjoy, if I'm riding or if I'm straddled or if I'm from the side or I'm sitting up here and you're standing.
Yeah.
That's even better. Like, let me sit up on the table.
Oh, okay. Because my mind went somewhere else.
I don't know where your mind went. I'm talking about sitting on the kitchen counter or the table.
Yep.
And them standing.
Oh, Jesus, my brain.
Put a chair underneath your feet for some support.
Oh, God. Ladies and gentlemen. The countertop, if you are short, just stand on a step stool. It makes it better. Just tell.
Oh, yeah, of course. But countertops have different sizes.
I know, but sometimes when you're on the countertop and his height is not, just step on the step stool.
Step stool?
Oh, step stool.
You can get those on Amazon.
You can get like the wooden stern step stool.
Yeah.
I promise you I have one, but like.
Or like the wooden ones we have back home that we sit on.
Ooh.
Yeah. Yes, everybody has one.
Let's get back to it. Sex after a baby.
Oh, yeah.
I have a good friend. Yeah. It took her almost a year to get back into the rhythm of sex after she had her baby.
Yeah.
Because she just didn't feel it anymore. She said she
didn't desire it.
And even when she got into it, she wasn't getting wet. It was dry,
Ooh, yeah. Sex after a baby can have different complications. Like, it can be complex, right? Because if I'm breastfeeding, now, what did I tell you? After I have sex, I have this release of a hormone called oxytocin. It makes me feel satisfied sexually, makes me want to sleep. That same hormone is released to all breastfeeding mothers. So partners, if your mother, and we want you to breastfeed. So don't say, oh, I'm not going to breastfeed or encourage her because I want to have sex. Breastfeeding releases that oxytocin. It's like a satisfied hormone release. So they don't necessarily desire, or they may not initiate sex because they're always satisfied. It's different. It's not like you get orgasms from breastfeeding, because I hear that too. No, it's just you're kind of like satisfied and you're at peace. Now, if you want to get back into a routine of sex, you have to actually kind of plan it. You have to make effort because you got a baby that might be crying, that needs fed every 2 hours. You got things to do, the baby clothes to put away. So like I told you before in part one, you gotta, it's not just physical, it's mental too. You gotta be mentally present to enjoy the sex. Now, if you're dry because of, the estrogen changes in your body, the hormones again, I love me some lubricant. Don't be afraid. And the first time you have sex after a C-section or a vaginal delivery, it can be uncomfortable. Like, why does that penis want to go back in? Like, things are happening, right? You may not be ready. So we say 6 weeks, but on average, it's whenever you're ready. Some people might take 3 months.
Some people is even earlier.
Some people are like 2 days.
That one, yeah, don't do it.
Some people are like 1 week. I stopped bleeding. I'm having sex. But remember, it's your preference based off.
That's early. Sorry, that's just in my head. That's early.
It is early. It's not me.
That's not yet.
But it's like, for me, I need my body to kind of heal a little bit. It does take like 12 to 18 months postpartum for a woman's body to heal. Yeah.
12 to 18 months?
It took almost 10 months to grow the baby before we consider term.
So then the people that go right back to having another baby
increases their risk for having smaller babies, preterm labor, and those kind of things. So your body isn't healed completely.
Wow, we're not going to get into
We won't.
But yeah.
We won't. But yeah, sex after a baby can be complex depending on the laceration. Like if you had a really bad tear that led straight to your anus, you may not want to engage directly into penetrative sex. You may want to do oral sex.
Okay.
But
to start off
small. Focus on the mental, intimate part with your partner rather than the physical. But, there's different positions that you can engage in, trying some lubricant, different foreplays. Just date each other again.
Silicone.
Love each other. Oh, yes. We love our silicone.
Silicone lubricant. Okay, I'm getting one right after.
Yes.
It felt good. Okay. But okay, let's just give your last words before we end it. This has been amazing. I really want to talk about other things, but I'll behave, okay? Because right now my head is just like.
I know.
Only God knows the conversation I'm about to have with my man after this.
Oh.
But yeah, so what are your last words when it comes to sex from part 1 to now? What are your last words?
We have talked about a lot. My last words are, one, it has been a pleasure talking to you guys about sex. I love to talk about sex and educate people about sex. I think as human beings, we are designed to enjoy and we are designed to have sex, but enjoy it. Yes. Let it be pleasurable. Let it not be focused necessarily on your physical aspect of it, but include that mental. Be present. Find yourself a partner or if you're in a polygamous relationship, find a couple partners that you trust, but really focus on the enjoyment for both parties. Explore your sexual options with toys, with some silicone lubricant, with the penis ring. Explore the different positions. Whether you are pregnant or not pregnant or postpartum, get back into that sexual routine, because sex is great for our bodies and our mental state because of that release of that hormone that gives us that satisfied experience. So I think always, we're raised not to have sex, but it's important to explore your sexuality and your sexual options. Communicate your needs with your partner. Preference. Tell us what you want.
Preference.
Tell us. If you can't tell us, maybe write it down.
Text it.
Yes.
So some women are more comfortable texting. So
yes.
text it.
Yes. So whatever it is, communicate. But those are my last words.
Sex is not, it's not a taboo to talk about it. Let's have conversations about it.
Be open.
Be open about it. We're all doing it, so let's not pretend, okay?
Yes.
And I'm still going to give out the penis ring, so just look in the caption, I promise. I really want to give somebody a great experience. I'm buying one myself, my man. Hey, babe.
Yes.
But no, I want everybody to experience great sex. Sex is not just for one person, it's for both. Both
parties.
Okay? Both.
Yes.
But yeah, thank you so much,
You're welcome.
Lisa, for coming. If you want to follow her on Instagram, her information will be below, but it's OB_and_beyond. Listen, go on her page. You're going to learn. I've learned a lot from her page. Follow her on Instagram now.
Yes.
Right now. Right after you finish watching this video, just rush to Instagram and follow her. She is amazing. But thank you so much for coming.
Thank you,
I have learned so much.
Thank
you.
You're
amazing.
Welcome. You're welcome.
Thank you. With that said, thank you guys so much for watching. Please go in the caption and read all the details for this penis ring. And thank you for watching. And I will catch you next week. You are watching Relate with VanJudah. And I was with Miss Lisa. Bye-bye. Catch you next time. Bye.